International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Hello, my name is Dr. Yazan Douedari. I co-authored a study with Dr. Natasha titled Perspectives on Rebuilding Health System Governance in Opposition-Controlled Syria, a Qualitative Study. In 2011, peaceful demonstrations started in Syria. The situation then escalated and armed conflict emerged. This conflict was characterized by systematic targeting of health facility and personnel in opposition-controlled areas by the Syrian regime. As a result of this, there was a collapse of health systems in opposition-controlled areas. We tried in our research to study grassroots initiatives to restore and rebuild health system governance in these areas. We designed a qualitative study using in-depth key informant interviews with 20 participants from 4 categories: health directorates, non-government organizations, donors, and service users. These 20 participants were chosen from 5 opposition-controlled areas in Syria. Data were analyzed thematically. In the results, health directorates were identified as the local health authorities responsible for health system governance in opposition-controlled areas. Health system governance elements were identified, including accountability, transparency, strategic vision, information management, effectiveness, equity, participation, and responsiveness. However, they were not addressed equally in different areas. Main challenges identified were security, especially targeting of health facilities and personnel, capacity, and funding. A vicious circle were found where health directorates said that they need funding to improve their capacity. At the same time, donors reported that they're not interested in funding health directorates because they lack capacity. Suggested solutions were improving coordination, supporting health directorates, and addressing health worker loss. The research key messages to policymakers are: first, political recognition of local health authorities is necessary if these grassroots initiatives are to succeed. Second, financial and technical support is urgently needed to support these initiatives. Third, to protect fragile grassroots health system governance initiatives, the international community must do more to end the bombing of health facilities and health workers in opposition-controlled areas. Thank you.